I'm Dr. Emily Kraft. Welcome to Airport Dental Care. So what I really like about the CEREC is it's easy to use on the dentistry side, and it's incredibly easy for the patient. It takes away a lot of the things that patients didn't like about having a crown done. One of those would be the impression with the goopy impression material. That was just really uncomfortable for patients, and there's none of that anymore. What we do now is we take a picture with a camera of the tooth, and then we make the crown here in the office instead of sending it out to a lab. And so as a result of that, we're able to make the crown the same day that the patient comes in. Because in the past, what happened is the crown was made in the lab, which would take several weeks. So the patient would have to leave with a temporary crown on their tooth and then come back in a couple weeks to get the final crown. And what would happen is either the tooth would become sensitive or the temporary crown would fall off and they would have to come back and get it re-cemented. Just a kind of a number of problems that would happen as a result of that process. But now we just have this ability to make the crown the same day so that when you sit down, we do what we need to do to the tooth, we take our pictures, and then the machine in the back mills out the crown. And we try it in, and we actually are able to, in the office, put some customizations and some staining on the tooth to really make it look as tooth-like as possible. And the results are just amazing. I can tell you that 100% this is the type of restoration I would get put on my tooth. They're just top-notch. And a lot of times when I look in someone's mouth that's had one done, I can't even tell which is the real tooth and which is the tooth that's had the CEREC restoration. It's just the results are amazing.